Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. With the Delta variant on the rise as COVID cases increase, Pfizer says it's time for a COVID booster. But in an unusual move, the FDA and the CDC say Americans don't need boosters just yet, and said this was not up to companies alone to decide when they might be needed. Here to clear some of the confusion on COVID booster shots is Dr. Margaret E. McCort, infectious disease specialist at Montefiore Health System. Welcome, doctor. Thank you so much for joining us today.
Thank you for having me.
Of course. So let's get straight to it, doctor. Can you help us answer the question on everyone's mind? Do fully vaccinated people need a COVID-19 booster shot? Please explain.
So as far as we know today, the majority of fully vaccinated people do not need a COVID-19 booster shot. So we know that the available vaccines have very high efficacy with the original dosing schedule, and they prevent severe disease and hospitalization in 90% of people. So the company Pfizer recently applied to the FDA to market a third dose of vaccine as a booster shot based on their studies, which show that the third dose is safe and it raises antibody levels in the blood above what they were with just the two doses. So whether or not you need all those extra antibodies is definitely up for debate. Every disease that we vaccinate against develops what we call a threshold level of immunity. We want to reach that level of immunity or antibody level that protects you from future infections. But if that threshold level is 80, having an antibody level of 200 is not necessarily better than the antibody level of 90 because both are protective. So I would argue that a booster shot to raise your antibody levels right now is not necessary. In the future, it's possible that it might be necessary if the SARS-CoV-2 virus mutates into new variants that are not protected as well by our current vaccines, but that's not the case right now.
Got it. Thank you so much for clearing that up for us, doctor. So do we know how long the vaccine will last at the recommended 2 doses?
So far, our best data shows that the immune response generated by the COVID-19 vaccine lasts for at least a year. We know that because the first people who were entered into the studies, the trials on vaccines, still have immune responses that are protective at this point in time. There are some other studies that have been done about how the mRNA vaccines affect our immune system that have shown promising results recently, that the immune responses that we are forming are actually protective for many years, we hope.
So another question, another pressing question about boosters is if boosters aren't recommended at the time, what happens after the protection fades?
So for all vaccines, we have a fading of our immune response over time, that the antibody levels gradually decline. And then for a lot of people, those antibody levels remain at a steady state that's somewhat protective. So for our measles vaccine, for example, we can retain protective levels of antibodies for many decades. But then over time, older adults may no longer be protected against measles, but because the general population is overall vaccinated enough, measles is not circulating, so those older adults are not at risk. Some vaccines, we lose our protective antibody level a little bit earlier. So our tetanus, diphtheria, or Tdap vaccine, we have to update every 10 years. But again, because we don't have lots of people running around with diphtheria pertussis, we're not at high risk, even if our levels fade, because it's just not circulating with enough people vaccinated. So ideally, the goal is that enough people are vaccinated against COVID so that we are not spreading it among our communities as the protection starts to fade.
Right. So, doctor, the CDC recently advised and spoke about considering an additional coronavirus dose for immunocompromised patients. Why would this be effective for this particular group?
So this question is a really good one for me. I deal especially in immunocompromised patients and study vaccine response for them. So those are people with who've received a solid organ transplant, a stem cell transplant, or who are receiving chemotherapy that suppresses the immune system. So these patients are especially high risk for severe disease from SARS-CoV-2. But they also may not have enough immune cells available circulating in their system to generate a response to any vaccine, let alone the COVID-19 vaccine. So for these individuals, we often give them extra doses of vaccines for other infections, but this COVID-19 vaccine is no exception. So for these people, it may be that third dose is just enough to help get them to that threshold level of immunity because they need a little extra help making enough antibodies. We don't totally know for sure that antibodies are the only way to measure the immune response to vaccines, but Certainly, these small portion of the population, about 5% of people who are highly immunocompromised, may be the ones who are going to benefit from the booster.
Got it. And are many immunocompromised patients already vaccinated? How are they feeling? When you speak to your patients, for instance, doctor, are they feeling skeptical about the vaccine right now?
Most of my immunocompromised patients are on board with the vaccine due to their high risk for infection. They in general know that they're the people who would benefit most from the vaccine. So they're mostly worried that ongoing spread in the community is still posing a risk to them because the vaccine is not 100% effective for them.
Right, got it. And so experts are also looking at potential side effects of booster shots, if that's something that's coming down along the line. Currently, what are the side effects of getting just two shots, doctor?
So the number one side effect of the COVID-19 vaccine is soreness in the arm, injection site reaction, that usually goes away after a day or two. Some people will develop headache, fevers, muscle aches that usually occur on the day following the vaccine and last for about 24 to 48 hours before going away. However, these symptoms are nothing compared to the normal symptoms that most people get from COVID-19 disease.
Got it. Thank you. We also spoke about the Delta variant on the show last week. Are the current two shots effective against this new variant?
So, from what we know about the published studies so far, it is true that there have been some more breakthrough cases of COVID infection from the Delta variant among people who were fully vaccinated against COVID with two shots of Moderna or Pfizer mRNA vaccines compared to what their protection was to prior variants. But most of these patients have not been seriously ill or hospitalized. So we know that in the US, 90% of people who are being hospitalized with Delta variant right now are not completely vaccinated. And studies in other countries have shown that the two doses of mRNA vaccines are slightly lower, about maybe 70 to 80% effective at preventing severe COVID-19 vaccine from the Delta variant. But that's still a really good vaccine. So our annual flu vaccines, for example, which have been proven to lower your risk of dying from the flu, are actually more like 60% effective. So an 80% effective vaccine is still a highly effective vaccine. And most experts agree that the current two doses are effective against the Delta variant.
Got it. Thank you, doctor. And so there's another debate among patients saying, or people considering the vaccine still saying, which one is better? Is it the Pfizer? Is it the Moderna? Is it the Johnson and Johnson, for instance? Which one has higher efficacy, doctor? Would you say that one is over the other?
So, as we've been saying since the beginning, the first vaccine that you get is the best vaccine. So, getting any vaccine is definitely better than nothing. You should talk to your doctor about your specific concerns about vaccines, but I would say all the vaccines that are available in the U.S. are certainly effective.
Right. And just speak about the importance, doctor, of also just getting vaccinated for those who are not vaccinated just yet, especially with this Delta variant in the United States and in New York, especially.
Yeah, that's my number one take-home message from that today here is getting vaccinated is just common sense right now. If you receive two doses of an mRNA vaccine or one dose of the Johnson Johnson vaccine, you're very well protected against severe disease, hospitalization, and death from any of the COVID-19 variants. The risk of side effects from the COVID-19 vaccine is pretty low. They're very mild, and it's definitely nothing compared to what you might face if you were hospitalized with infection. So my recommendation would be to go ahead and get the vaccine. And remember that masks still work as well. So if you or some of your family members are the type of people who may not be fully protected against the vaccines, remember that you can still wear masks to help lower your risk of getting infected, especially when you're traveling this summer on planes or subways. So.
Right. Doctor, I also want to talk about a little bit more about vaccine hesitancy and, how our communities are feeling about the vaccine. What are you able to tell your patients about, just the vaccine in general, when they're a little hesitant about it still?
I usually go through, what is our vaccine made of, and we know all the ingredients that are in our vaccines. They're safe ingredients. They've been very well studied. There's nothing in the vaccine that's going to remain in your body. It all is dissolved or goes away after a few days. What the vaccine is helping your body retain is it's teaching your body how to recognize the SARS-CoV-2 virus. So vaccines in general are very safe and have almost no long-term side effects ever. So there's no reason to believe that these would have any sort of the long-term effects. Really, it's just common sense to get vaccinated.
Finally, doctor, can you leave us with a message on best practices to protect ourselves from this virus a year into the COVID pandemic? I know a lot of people think it's over, but it's not.
Yeah, it's definitely not over. So stay vigilant. Make sure that when you're choosing activities that you remember that COVID is still around. So get vaccinated, get your friends vaccinated, get your family vaccinated, and don't be afraid to ask people before you hang out with them in close indoor spaces, are you vaccinated? Just to help protect yourself.
Thank you so much, Dr. Margaret McCort, infectious disease specialist at Montefiore Health System, for joining us today and talking about COVID-19 booster vaccines.
Thank you.
Of course. Again, you can visit montefiore.org for more information and stay in touch with Montefiore Health System on social media. Our experts are always joining us here on the show, so also stay tuned to Open BXRX Tuesday for updates as the COVID-19 pandemic continues. We're taking a break. We'll be right back here on Open BXRX Tuesday.